Welcome back. You're watching McLaren Port Huron's Today's Health, and we're talking about kidney stones with board-certified urologist Dr. Glenn Betrus. Okay, Dr. Betrus, we want to spend just a few minutes more on prevention because there's a lot of myths and ideas out there. So can you just talk to us a little bit about the questions your patients ask you and what you tell them?
Sure. In terms of preventing kidney stones, you want to, like we talked about before, increase fluid intake, and the best things to drink are water, lemonade, and orange juice. There are certain things that you want to decrease in the diet, namely meat and salt, because meat and salt increase the risk of getting kidney stones. Also oxalate. Oxalate is a chemical found in green leafy vegetables, chocolate, coffee. Those are some of the sources of oxalate. So in somebody who forms their first kidney stone, that's the general advice that we give them. If a patient is what we call a recurrent stone former, meaning they're on their second or third or higher stone, then we do additional testing to try to determine specifically why they're getting kidney stones. So that would consist of doing some blood work and also a 24-hour urine collection. So they collect their urine for 24 hours. We have the urine analyzed. We're looking for their citrate levels, for example, because citrate, again, prevents kidney stones. So if somebody has a deficiency of citrate, then they're more likely to develop kidney stones, and we would then prescribe medication, a citrate supplement. We're also looking at their calcium levels, their oxalate levels. If those are high, that would be a reason for them to develop kidney stones. If their blood levels of calcium were high, then we would want to consider a condition called hyperparathyroidism. The parathyroid glands are immediately behind the thyroid gland in the neck, and a tumor within them causes too much parathyroid hormone to be produced, which in turn causes calcium levels to be high, which in turn causes kidney stones to form.
Wow, sounds like there's also quite a bit of lifestyle changes that can go on. Are there medications that would help prevent kidney stones?
There are a couple categories of medications that can be taken for calcium stones. We talked about the citrate supplements if somebody's citrate levels were low. In some instances, if the calcium levels in the urine were high, taking hydrochlorothiazide might be helpful. That's a diuretic that decreases the calcium excretion by the kidneys. For uric acid stones, sometimes potassium citrate is helpful, and also a drug called allopurinol. And then there are other medications available for cystine stones.
Well, we didn't prevent them, and now we have symptoms of a kidney stone. What are they?
The classic symptoms of a kidney stone are pain, usually in the kidney area, but the pain can radiate downward toward the groin area. Nausea and vomiting are common symptoms with kidney stones, also blood in the urine, and in some instances, changes with urination, such as burning with urination and frequent urination.
Can kidney stones be serious? Let's say your pain is on the lower end and you don't really feel too bad. Can you just kind of try to ride it out?
In most instances, yes. So if somebody has only one kidney and that kidney is blocked by a kidney stone, then that can cause kidney failure. So that would be something that couldn't be put off. Occasionally we see patients that have two kidneys and they have a stone in each ureter, so both kidneys are blocked. So again, that creates an emergency situation. And certainly if somebody has an infection and a kidney stone simultaneously, that can be more of an emergency type situation. But most patients, they can wait it out as long as their pain can be controlled.
How do you make the diagnosis of a kidney stone?
On X-ray, and there are a multitude of X-rays that can show kidney stones. The most commonly used are a plain X-ray or a CAT scan. Certainly a CAT scan is the best test to determine whether somebody has kidney stones. And it's not just do they have kidney stones or not, but it's the size of the stone, the location of the stone, how many stones, and whether there's an associated blockage being created by a stone in the ureter.
So that what's next for the patient question is informed by all those things you find out.
Exactly. So for example, if somebody had a very small stone in the lower ureter that was real close to the bladder and almost passed, almost certainly we would expect that patient to be able to pass that stone. On the other hand, like the diagram that we looked at earlier, a large stone in the upper ureter, that stone is less likely to pass, and therefore we would be having a conversation about treatment options.
Well, let's have a look at that Okay, so these 3 kidney stones here are in the kidney.
So these 2 are actually in the kidney.
Okay.
This one has just left the kidney and now it's in the ureter. So if this patient had pain, without question, this is the stone that's causing the pain, not these 2.
Okay, so they might have been there for a while.
Correct.
And are the relative size of those stones, is that accurate?
It is. I mean, they range from small to big, but there's nothing unusual about the size of any of these stones.
So people that have had kidney stones wax quite eloquently about passing these kidney stones and a lot of details. So can you tell us from your perspective what it's like to pass a kidney stone and how long does it take? And
So it can take weeks or months if you let it. And so generally it's a matter of how much pain somebody can take or endure before they finally say, okay, I've had enough. So in other words, if you had a stone that had a reasonable chance of passing and the patient was comfortable, then we'll prescribe pain medication. We'll prescribe medication that causes the ureter to dilate, which increases the likelihood of the stone passing. And as long as the patient's pain can be controlled with pain pills, we can be patient and try to give that stone time to pass. But if the patient's having severe attacks, and the attacks can be very profound, then you certainly would not want somebody to suffer unnecessarily. And so those are the patients that typically would consider surgical removal of the stones. One anecdote that I think is worth mentioning is that when you talk to women with kidney stones, most of them will say that passing a kidney stone is more painful than childbirth.
wow. Okay.
Says it all, right?
Yeah, that's right. Pretty painful. So I have to ask you then, if you don't pass your kidney stone, what are the treatment options?
So there are 3 different types of surgery that can be performed. One is, well, we'll go from least invasive to most invasive. The least invasive is a procedure called extracorporeal shockwave lithotripsy, or ESWL. The original machines in the 1980s required that you be placed in a bathtub of water, and shock waves were generated and aimed at the stone to break the stone up into small pieces. The newer technology allows us to have portable machines that go from hospital to hospital. Rather than a bathtub of water, you have something that's almost like a beanbag that gets pushed up against the patient's skin, either in the lower back or in the abdomen. And there's a shock wave generator within that beanbag, and shock waves are aimed at the kidney stone to break the stone up into pieces that could then pass. The second procedure is to go up with the scope, and you can pass the scope into the bladder, up the ureter, up to where the stone is, and then pass a laser probe, a Holmium laser probe, through the scope, touch the stone with that laser probe, and then the laser energy breaks the stone up into small particles that could then pass. For the largest stones in the kidney that are really too large to do either of those procedures, we can do a procedure where we make a small incision in the back and pass a scope directly into the kidney, and then use a probe to break up the stone and simultaneously remove the pieces of the stone.
We're going to talk a lot more about those procedures and get some more information about what the patient experiences. But first, we're going to take a break.